For me, coming from the perspective as a family caregiver, I really want my healthcare team to communicate clearly. My sister-in-law is nonverbal, but she can hear clearly and she can understand things. And I want our care team to communicate with both of us, our family and her, and pay attention to those nonverbal cues that she gives.
Well, as a patient, I would like to be considered a real person. I would like people to react to me like I'm not just a number. And whether they're maintenance people or dietary people or CNAs, I would like them to talk to me, let me know who they are, why they're in my room, and what they're going to be doing. And furthermore, if they're part of the actual medical care team, I would like them to listen to my concerns, my fears, and get to know me as a person. And subsequently, I would feel more like I'm part of my own healthcare process.
Well, I think it's important that we feel cared for right from the beginning, and that starts with the registration. I think it's important that we are shown compassion, and it helps us know that we are in a safe place and in good, safe hands. I want to be thought of as an individual, and like I said, not just a person from a crowded lobby. I want to be listened to and heard, and I like to have things explained to me so I know what my options are, I know what my test results are, and I know what the risks are.
I think that the most important thing for me really is the sense of credibility and safety. And I think back, I'm an engineer and a project manager, and I think back about with the quality movement here in the US and internationally, I mean, the key to quality was eliminating fear. So when I go into a stressful situation, like a healthcare situation, what I'm looking for is safety. And to eliminate fear, I find two things that really help me deal with that: deep expertise and really deep trustworthiness. What signals that to me, I find, is how much time they take with me and how well they're collaborating with others there in the group, in the healthcare team, so that one person is knowing what the other person's doing. But also they signal to me that they have the time for me, they're listening, they're asking me questions that show that they're listening. And I had one experience though that really exemplified this for me. I had a knee replacement done here at Enloe about a year and a half ago. And it was from a really bad bike accident that I had. And Dr. Cummings, Brock Cummings, was the surgeon. And so I had been getting ready for this surgery. I was actually on the gurney. Everything was prepped for surgery. And then one of the nurses saw that I had a wound, a scratch on my leg that was not there before. So it was a fresh cut from me doing some work around the yard and things like that. And what really impressed me was they called the surgeon over. The surgeon was all prepped for surgery. The whole room was ready. He took a look at it and said, no, we're not doing it. It would have been very convenient for him to continue with the surgery, but because of the risk of infection and what was in my best interest, they called it off. That really impressed me, just to have that type of care. To me, that just was a great example of why I wanted to be part of this group and talk about, what would matter to me with Enloe.
It's important to me to know that the people taking care of me understand what matters to me. If I want to have my husband there with me, they need to understand that and help make it happen. I need to understand what all of my test results mean, and I want to be listened to. Sometimes a care provider will even sit down beside you and take the time. It's difficult when you feel rushed. It's hard to make sure they understand you when you feel rushed. So just being heard is very important.
I want my healthcare team to make me feel like, and my sister-in-law feel like, that we are individuals. We're not just another number in the hospital census, and that they're there to support us as human beings.
Well, I think the first thing is that they would be a good listener. that they would be able to hear me and actually listen to what I have to say. And part of communication is that they would also explain to me what's going on or what's going to happen, and to take the time to make sure that I understand the explanation, to make it clear what it is that they're going to do and what they expect of me. And then last of all, I would like them to really have some empathy, some compassion for my situation, and if I'm frightened or worried, they would acknowledge that and address that.